Welcome to Condom Distribution as a Structural Intervention, Midwest Virtual Institute, brought to you by AIDS United as a part of the CVA Provider Network, supported by Cooperative Agreement number PS 19-1904 from the Centers for Disease Control and Prevention.
And that is that we are going to go through and review the 4 Ps. Like I said, we love a little alliteration for the 4 Ps: product, price, place, and promotion. We're going to review how they are an integral part of the promotional framework for condom distribution programs specifically. We're going to look at them both generally and also how they apply to our own work. We're going to look at the role of promotion for CDSI, go through some skills and knowledge related to developing a promotional plan, and then increase our understanding of how this is integrated into other CDSI activities. A little later, Marilyn will cover some of the ways that it plays into evaluation. So here up on the screen, you see our 4 Ps. Social marketing has these 4 Ps that guide pretty much any social marketing campaign or effort. And we want you to keep these in mind as you think about designing your own social marketing campaigns for condom distribution. The first is very straightforward, just your product. So through your promotion efforts, the products that you're marketing are condoms and condom usage. I'll emphasize that a few times throughout the presentation, but we do, as we speak to the pieces on acceptability and accessibility, we want to make sure that we're promoting both condoms and condom usage. This duality is really important because we want people to not just have condoms in their hand, but to actually use them. The second P is price, or rather the cost of your product. So while the condoms themselves are free for participants for the most part, there is still a cost that is associated with things like behavior change, and now that we think about COVID, a cost when we think about risk factors. So this doesn't have to be just monetary, it can also be emotional labor. So things that we talked about on the acceptability panel, negotiating social expectations and stigma and reactions can all be part of the price that we consider in this model. The psychological cost that comes with changing your thought process and attitudes around condom use is another thing to take into consideration. When we think about COVID, we recognize that there is a cost involved in going into a physical space and picking up a condom. For those that can't get condoms through mailing programs, there is a risk, whether that be to yourself, to your family, or to a loved one, that is associated with condom distribution during this time. So we want to think about that price as well when we're marketing to our audiences. The third P is place, and this is where and when the audience is going to perform the desired behavior. This is especially relevant during the pandemic. So pre-COVID, we've relied on things like bars and clubs and community hubs. And as we've talked about, there's a lot of restrictions on those places now. A lot of our partnerships have shut down. A lot of the ways we used to collaborate with people just don't work anymore. And so we're adjusting to some of the examples we heard earlier. Barbershops, nail salons, gyms, food pantries, laundromats, apartment complexes, all of these different places that maybe we weren't looking at before. A place can also be with our partners or in any other situations where condoms are going to be effective. We can even think about the virtual world or like this digital space that we're all inhabiting as well. Although we can't do anything funky and fun like teleporting or 3D printing condoms, it's definitely important to think about how we can use these virtual spaces to increase condom acceptability and also let people know different ways that they can access condoms. The final P, which is what the majority of this presentation is going to be about, is on promotion. So this is the campaign itself and any efforts that you use to discuss condoms in more details. So product, price, and place are really important to consider, but we're going to hone in especially on that promotion piece. And so with that, why is it important to talk about promotion for condom distribution? And yes, as Michelle said, also the lube. So why is it important that we talk about distributing condoms, and why is it important that we promote condoms, lube, and condom usage? Can people plop their thoughts in the chat? For safer sex, yep. What else? Why else do we need to promote our condom distribution programs? I know we're just coming back from lunch, y'all, so give me that energy. I believe in you. Thank you. That's the obvious one, so people know that they exist. Educational purposes, to educate those who don't know how to use a condom. I really like what Sue just said, which is you can't assume people know that they're there. You know, if you have all of these programs in place, but community members don't know where to go, don't know how to access them, don't even know that they exist, they won't get to the people that need them the most. So you're right, they help people feel comfortable about using them, show a variety of options. Awesome. Reach the populations that need them the most. These are perfect. Thank you, everyone. So in addition to all of these things, promotion also facilitates and increases a demand. So when we think about condom economics, which we talked about yesterday, there's that supply and demand. It's going to increase that demand and give us a better idea of how many condoms we actually need moving forward in order to supply and meet the need that is in a certain community or in a particular jurisdiction. Without strong promotion, a condom distribution program is going to have challenges in increasing this demand and awareness of where condoms are accessible. So this piece is key to ensuring that condoms are getting into the hands of those who need them. Thank you. So on this next slide, we really want to touch on the importance of promotion. And so we're going to look at this quick little case study. Hey, people just give me a quick thumbs up. I'm going to look over here at the reactions if you enjoy Oreos, and maybe give me a gasp reaction if you have no idea what Hydrox is. All right, I'm seeing some thumbs up. I'm seeing some thumbs up. Seeing some gasps. Yep. Awesome. Thank you all. Oh, Doug knows both. Go, Doug. So what a lot of people don't know is that Oreos, which is the one you see on the left here, are actually a knockoff brand. So Hydrox cookies were first came into play in 1908, and they were the first of this kind of like cream-filled chocolate sandwich cookie. Oreos didn't show up until 1912. I like the comment that Hydrox are terrible. So despite being kind of similar in construction and appearance, Hydrox ended up failing as a product. No one was buying them. They couldn't get them off the shelves. I would love if someone could give me just one guess, other than perhaps Devin's comment that they don't taste very good, as to why the Hydrox cookies might have failed. Based on the focus of this presentation, I bet any person in this room could answer it. Packaging, the name, marketing, advertising, not visually appealing, not promoted well. Y'all got it, nailed it, right on the head. So Hydrox failed because of a promotional problem. It was specifically because Hydrox's name, despite being very similar in price, product, and place, the promotion was all off because of the Hydrox name. So Hydrox kind of conjures up this weird feeling of biological chemicals and sterile environments. It's a very medical sounding name, and the public just didn't feel compelled to eat a cookie that was associated with that kind of sterile chemical imagery. So Oreo essentially swooped in, took advantage of this gap, renamed and rebranded, and now they are clearly the cookie that everyone's mind goes to when we think about these delicious milk favorite cookie. So we're going to skip on over to the next slide and talk about this as it applies to condom distribution. So as we've talked about, condom distribution and promotion is specifically supposed to address accessibility and acceptability. By this point, we should already have availability down. You don't want to be doing promotion if you don't have condoms that are available. At this point, you already have them in strategic places, you know where to direct people, and there are ways to get condoms in the community. What you're doing now is intended to raise awareness and acceptability of these resources for the communities that need them. So the accessibility piece aims at informing the community of how they can access the condoms. Acceptability, on the other hand, aims at changing the norms around condom use. So again, when we go back to what I was talking about with the products, this is the difference between promoting condoms and promoting usage. They should absolutely be intricately intertwined, but we want to make sure that both are happening. Promotion is aiming to do exactly what Oreo did for their cookies, which is to create an appealing product through imagery, through narrative, to encourage community members to find and to use condoms. Next slide. So we're going to look at 4 main steps for creating a working promotional plan. The first is that community assessment piece, which we have dug really in depth with earlier, but we want to focus in on how this applies to promotion. So you want to start by defining your target audience. Who are you speaking to? Who needs to know about the condoms? And who are those people? What are their interests? What are their needs? What might appeal to them? And from there, you want to choose your delivery channels. And so that's thinking about, what is the best way to meet my particular audience? Do I want to use radio? Do I want to use social media, advertisements on public transportation, television? How can I meet my target audience through very specific and intentional delivery channels? Once you have an idea of all of those pieces and have that established, you can start developing messaging. So we'll do this by doing something that we'll look at later, which is pre-testing and refining. You want to start by looking at the language used by other condom distribution programs, but also by communities. So test out a few message, run them by community members that are part of the populations that you want to reach, and start tweaking to find the ways that you can create a message that not only lets people know where they can get condoms, but also speaks the language of the community and encourages them in whatever ways makes the most sense to actually use the condoms that they're accessing. We'll encourage in the developing messaging stage as well to do an internal systems review and a community review. With this, you might even want to consider piloting part of your messaging. So for instance, I remember at an organization I used to work with, they did a Metro ad, and what they did was that they paid for just a few cars to start with. They put, I think, maybe 5 cars. They had big advertisements up on that little space above the chairs for people to look at. Before they invested in having it on multiple lines, they made sure that it felt appropriate and that it was reaching people, which they did by putting a very specific URL on that advertisement that they could then trace back and make sure that it was reaching communities. So think about the different ways in which you can pilot something, in which you can get community input, so that you make sure that whatever it is that you are putting out is actually going to have the impact that you want it to. Next, of course, you have the obvious, which is implementing it. So once you have all of these pieces together, you just go ahead and actually put it into practice. And then finally, you'll go back and evaluate it. You'll circle back if you need to the community assessment and the developing messaging phases by just checking your analytics, seeing if it has reached people. And if it has not, what do you need to do in order to adjust? So on this next slide, we're going to go ahead and get out our annotate function again and start looking at the questions on the screen. I'm going to go ahead and talk a little bit more about the community assessment, but I encourage you to kind of respond on the board with this. In those first 2 boxes at the top, you can go ahead and put stamps in whichever one feels most correct. So whether or not you have done community assessment to gauge specifically accessibility and acceptability. And if you did, what did you find? And we'll look at those answers in just a second. So the step to doing all of this promotion stuff is to do that community assessment like we talked about. You want to spend some time focusing a few specific activities within the assessment, such as segmenting your population, choosing those delivery channels, and developing messaging. We know that it's important to do community research for condom distribution promotional campaigns because we need to know where the gaps are, we need to know who we're creating messaging for, we need to know the target population attitudes about condoms. We need to know which of the 3 A's to address in your community. We've already touched on acceptability a little bit as a key factor that's in the Midwest, but even within your very specific jurisdictions, what are the nuances and barriers that are specific to those 2 A's? And have those changed during COVID? We may have to circle back at certain points to say, we did a community assessment, we understood what people's values and understandings were around condoms, and now maybe they've changed. Maybe they have adjusted now that this additional layer of the pandemic has come into play. So I see that people are plopping some answers in here, and I see a smattering of yeses, but a little bit more nos. And so, not a worry, Doug. If you forgot how to annotate, you're also welcome to use the chat function at any given point. But if you do need to access it, go ahead to the top of your screen, click View Options, and then Annotate, and a little bar will pop up for people to use. But as more responses are plopping in, I see that for quite a few people, the answer seems to be no when it comes to accessibility and acceptability. A lot of the conversations, by the way, we get that. It definitely happens. A lot of our conversations are around availability and whether people actually, if there are actually condoms that people can go ahead and get. But I think more likely than not, people are, whether it is intentional or otherwise, asking questions that do get to that core component of acceptability. And I'm going to look at that in just a second. Community research is a process that we do want to take during the community assessment phase of implementation. Because if you're not doing so, we want to ask some of these questions that are getting into accessibility and acceptability as they relate to promotion. So I'll give this example that's up on the next slide. We can go ahead and take annotates down. Thank you. So on this slide here, we have an example from one of our health departments, which is a prevention needs assessment that was conducted in 2019. The goal was to see who had access to condoms, whether or not people felt that they were available in their areas, but it also asked whether or not people were using condoms and whether or not they used them despite having or not having them. And so despite the fact that there wasn't a specific intention to look at acceptability, this prevention needs assessment actually did speak to that. So they ended up finding that condom aversion remained very high, even when reports of condom access barriers were low. So that implied that even when condoms were in place, even when people knew how to get them and could get to them easily, acceptability was still our barrier. We understand here that now having this information, that should impact how we move forward and how we decide to design our promotion programs. We want to create messaging that aims not just at, hey, you can go over to your local bar to get a condom, but hey, you should be using condoms because of XYZ, because of things like what Heather spoke about, self-care, wellness, all of those different pieces. So let's talk a little about defining our audiences, which is on our next slide. Thank you. So the goal here is to get as specific as possible with the questions that you're seeing up here on the screen. I'm not going to read through all of them, but I encourage you to jot them down, take note of them, and we can also send some of these out later. It isn't necessarily critical that we find every single nuanced segmented population, but it is important to be aware of some of these larger groups and some trends. It's impossible to tailor unique messaging to every single person that we come across, other than in individual conversations, but we do want to identify some groups and use some broad strokes to create larger populations under which those more niche communities might fit. So messaging can be tailored to fit the needs of these unique populations, and then you won't overlook some of the identified niche ones. So like, for example, we talked about yesterday that one of the key populations that the CDC focuses on for CDSI is young men who have sex with men. We obviously know that not every young man who has sex with men shares the same social norms as the next one. We know that health needs are not exactly the same, wants, desires, they're going to vary for every single person. However, there are things that we can find in common with different subpopulations. It's how we do distribution, it's how we find prevalence, it's how we find the specific areas in which people have need. And so I want you to keep that in mind as we move into some questions and as we move into our activity, which is on the next page. All right, So if everyone can pull up their workbooks again, we're going to be on page 25. And if you still don't have access to it, our tech team just dropped a link in the chat. What we're going to do now is we're going to break out into 3 groups, each of which is going to have a facilitator. And we want to spend about 10 minutes digging into some of these questions specific to you and specific to your region. So you'll see an activity on defining target populations, which we're going to walk through. Essentially what you want to do is in that center circle, you're going to put your main population, who exactly it is that you feel perhaps is one of the highest need groups, who you're trying to reach through your messaging, and then outside of that, we'll spread out and think about some of the niche populations we're trying to reach. I'm going to plop some questions in the chat for people to think about as we walk through this if you get stuck, and I encourage you to take those with you into the breakout rooms. We've got AAMSM, we've got prep clients. I know my group specifically talked a lot about older populations or people who are divorced, people in nursing homes. I'm glad that people were able to take some time to really break down some of these segments and really start thinking about, I think our group kind of started doing it naturally, but thinking about where we can find those people. Mute my Zoom, where we can find those populations, how we can best reach them, and even in some cases, how we need to reach those around them in order to increase accessibility, availability, and acceptability. So thank you all so much for that. We're going to plop back over to the slides, and we're going to talk a little bit more about messaging. So like we're talking about, I hope that this started thinking about who you need to reach. And now we're going to talk a little bit about what we need to say to all of those people that we're trying to reach. So once you've defined and segmented your audience, the next step is to determine your delivery channels. There are 3 main channels that you'll see up here on the screen. Those are peer-to-peer interactions, traditional media, and social media. By no means are these the only ways, but these are kind of 3 big ways that we can capture certain promotion tactics. The first is peer-to-peer, and this just happens in in-person conversations or discussions. This is just someone comes into your clinic. Oh, we can go back to the last slide. Thank you. Someone comes into your clinic, you're describing and talking about condoms and condom usage, the merits of condoms. Most of these types of this type of channel will show up when we're sending outreach workers out or volunteers to hand out condoms in various spaces. This is often conversations in bars, in clubs, barbershops, any major place where community congregates. Now that might be virtual, but anytime that you're having those one-on-one conversations, that's that peer-to-peer place. We do have to get more creative during the pandemic, and so we have to think about how these conversations can happen in places like protests, in polling lines, in virtual chat rooms, virtual parties that people are having, some of those things that are reopening, so like gyms, that kind of stuff. This can be helpful to keep the conversation going and keep creating community spaces even when we're not able to do so in person. The second channel is traditional media, and this is any effort that uses static unidirectional platforms to discuss condom promotion. So essentially what that means is it's any sort of promotion that people cannot immediately respond to, where they're getting a message, they absorb it, but there is no necessarily way for them to interact. Examples of this are things like flyers that you might post in a shop window, posters, a bus shelter advertisement, things like that, where people are not able to just right away respond and communicate with whoever has put that message out. Social media, on the other hand, is something where people can instantaneously interact. So that's generating conversations and building communities through things like Facebook and Twitter, Instagram, stuff where people can immediately put a comment, like something, share a tweet, so on and so forth. These offer ways in which we can constantly be updating and improving our promotional messaging and our assets. So we're now going to go on to a quick activity where we just want to show some of the ways in which we can include promotion in various settings. So if we pop on over to the next slide. Looking at this, which is a metro car, can people tell me in the chat ways that we could integrate promotion into this setting. How can we do condom promotion for usage and for just accessibility of condoms on a subway car? I see Doug saying posters. Other thoughts as to what we can do in this railway car? Handing out flyers, signs. Awesome, awesome. I think once we go through one of these, the creativity will come out. Pole dancing, I mean, hey, that's one great way to start those peer-to-peer interactions, that's for sure. Overhead announcements, that's a great one. All right, we'll pop up the first one, which is train ads. So as you'll see popping up on the screen, this is any kind of eye-catching advertisement. That can be anything from a picture of a happy couple with a headline about condoms to a map of where you could find free condoms in your particular city or near where that line is. The next one that's going to pop up here is a person with a backpack. So this will offer things like merchandise can be a really great way of using traditional media that moves. And so things like I've seen a lot of colleges that will use pins and stickers that people can put on their backpacks and walk around, and that serves as like a free promotional activity and gets the name of your program or your website out in public. The next one would be Twitter or social media. People are constantly on their phones when they're commuting. And so while we can be using social media at just about any time, we do want to think about the specific times of day when it might be best to target people. It's going to be a little different during COVID because not everybody is doing that 9 to 5 train commute. But think of when people are taking their lunch breaks, so that 12 to 1 block of the day. That might be a great time to be reposting things on social media, sharing things out, trying to connect with community members so that they can see your advertisements. And then the last one, which I do believe I saw Sue put in there, would be a speaker ad. So when we think about promotion, we got to be creative with the mediums that we're using. I really like to share this example of how I actually first heard about PrEP many years ago, maybe not many years ago, a few years ago. And that was when I used to commute to my internship in the mornings. There was a very specific bus stop that whenever our bus rolled up to that station, a little jingle would come on over the overhead and tell us what PrEP was, a quick information on how to get onto their website, how effective it was, what the purpose was, all of those different things. And after I heard that a few times, it really finally got me to actually go on the website and learn a little bit more about HIV and PrEP. And so thinking about, especially in our daily lives, how we can create multiple touch points for people to hear about condoms, to make it more regular in conversation, and to even just by talking about it and having things like an overhead speaker that gives an announcement, that automatically encourages condom usage and starts to break down some of that stigma. So let's go to the next setting, which is a clinic waiting room. Can people drop in the chat some thoughts as to what kind of promotion we can use in this setting? I see video loops. That's a really great one. Table toppers, big bowls of condoms. Yes, yes. Brochures. Awesome. Y'all knocked out most of the ones that I had in here and some more, so that's really wonderful. So we'll start popping some up on the screen, the first of which is a condom dispenser. So providing condoms free of charge at your clinic is really a means of promotion itself, as clients will then chat with one another about the open availability of condoms in your space, and that will, by word of mouth, start spreading to people who are in the communities. The next one that we have is like a pop-up banner, or as some people mentioned, pamphlets. So supplementing the free condoms with large promotional materials that are in the space, as well as pamphlets that clients can then privately take to read. They can take home with them. Excuse me while I get my cat out of my lap. And this is another way that can then be a mobile form of traditional media where people are sharing those out to their networks. The last one we have in the clinical setting is reading materials. So not everyone is necessarily going to want to pick up a pamphlet that has the word condoms right on the front. There still might be some shame and stigma around that. But let's say that you have magazines or books or something like that that might more discreetly highlight positive stories and provide information and education around condom use. And also, yes, thank you for the suggestion for candy and chocolate. That is always a wonderful thing to integrate into condom distribution. This next slide is a very quick one, which I will just walk through for the sake of time, and that's thinking about doctor's visits. Think about the ways that in a more private setting, once people have gone through that door and are no longer in the eye of the public, how can you put your big bowl of condoms out there? How can you have a condom dispenser in that space? How can you put up posters and provider information that automatically provides some means of destigmatizing the use of condoms? Think about as well the ways that you can work with providers and say, hey, we have this program. How are you making sure that you talk to our clients that are coming into these spaces and ensuring them that it is important to be using condoms, that it's healthy to be using them, that we want to be having these conversations both as client and provider, but also amongst communities. And this very last one that we will quickly look at, and I really want your thoughts on this one, is a Zoom meeting. Thank you. So thinking about Zoom meetings, online events, other virtual means of connecting, especially during the pandemic, can we give some examples of how we could do condom promotion here? I really want y'all to be creative. What are some thoughts? None at all? We've been on Zoom this long. I believe in you. See, demonstrations is one. That's a really great idea. The background of your camera, a funny condom t-shirt for a condom conversation piece, starting off with a joke. I love these. I love these. I love these. All right, we'll plop a few on the screen. I'll quickly go through them. The first someone did mention is that Zoom background. So as you might be able to see on the Zoom, I don't have a background on now, but earlier we did have a few things in the background just saying that we're AIDS United or saying what our names are. And so if we're doing condom distribution, how can we think about adding in a really short URL that people can type in and go to learn more about free condoms? How can we even just put an image of a condom or something to catch people's attention so that that promotion is getting out even when we're in this virtual space? We also have clothing, which I know someone mentioned. Someone said a funny condom t-shirt. So when we're holding online community events, take into consider what it is that we're wearing. Can we wear a branded shirt that talks about condom distribution? Can we have wristbands that say free condoms? Think of creative and innovative ways to integrate promotion into your imaging. And then of course, very last, as you'll see up here, we have the chat function. We've been using it throughout the entire time, just dropping in links here and there, and you can do that as well. Dropping in links for participants to see where they can get condoms, where they can learn more about them, where they can access all of these different pieces. Also, I love Marilyn's suggestion right now, which is music about condoms. I think that's a great one. So as we start to wrap up, once you know where your message is actually going, it's time to craft it. Crafting a message is all about tailoring your specific program's promotional efforts to resonate with your audience, as we have mentioned. And once again, once you've done that internal brainstorm and started maybe jotting out some of those ideas that you have, that's when you then want to sit down with some representatives from your community or for some people who you might be targeting with this messaging and say, you know, does this make sense? Is this something that will land well with community? Or do we need to adapt? Do we need to change? Is this not going to actually impact our community norms or impact the way that people access condoms? Essentially, we're going to do some of those pieces that we just did in breakout groups, but with our teams and in a bit more of a deep session. The last thing we have on here, which we won't talk about too much, is community interviews. And this is, again, going back to the community assessment. We talked about this a lot yesterday, but essentially you want to continue taking data from that community assessment and pulling that into the type of messaging that you have. We can go on to the next slide. This is again just about that pre-test, refining, and implement. We just want to emphasize that even once you have feedback, before you implement a promotion strategy, consider doing a trial in the intended environment. Then you can go ahead, once you have that buy-in, once you have that certainty, and implement it. I'll take just another minute or two of your time to talk about some successful campaigns, because I think they're super helpful, and we can also plop some more information about them in the chat. I'll actually go ahead and drop the link to the first one. The one on the left that you see here is Ignite Your Status, which is a campaign that was launched in Southwest Center in Phoenix, Arizona. And this was specifically targeting young MSM of color. And this was essentially a condom bar that traveled between different gay bars and other spaces where the target population spent their time. And it adjusted wherever it went to try and meet the demographic of the space. I think right now they are readapting the bar into Latino gay bars so that it can specifically meet the needs that are there. But it's just a way of like making the conversation around condom usage a little bit lighter, a little bit goofier, and putting it in spaces where people are already accessing or already congregating as community. The next one, which is the one you'll see in the middle here, is Project Red Ribbon in the Philippines, which I believe we talked about a little bit, but that might actually be the next one, my bad. Project Red Ribbon, which is a response to the HIV epidemic. They enacted a low-budget, high-impact solution where they distributed condoms in paper bags with their program flyers attached. And as a result of doing it in this way, the program was able to distribute more than 235,000 condoms to citizens in 2015. This was a difficult space in which to be kind of having these conversations. There was a lot of stigma in this area, and attaching flyers to the paper bags allowed them to promote services while continuing to maintain some level of confidentiality and some level of discretion, because it wasn't anything big, it wasn't anything flashy. People could turn it over and it still just looked like a lunch bag. The very last one that I will quickly touch on is the Puerto Rican Cultural Center's VITA program in Chicago, which was focused on HIV prevention for young men who have sex with men of color who were living in Chicago at the time. And essentially what they did was they had popular drag queens in the Chicago area come in and facilitate empowerment groups and safer sex workshops. And in addition to this, the group would ask several queens from like RuPaul's Drag Race and stuff like that to facilitate, bring people in, get the attention of community, and then provide free HIV testing and condoms to everyone. I am going to very quickly plop one more link in the chat for everybody, and then we're going to go on to the next slide. And we are just about done with condom promotion. So though this is the last piece of your plan, the evaluation piece is an ongoing process. So as communities change, condom distribution efforts need to change as well. A few things we want you to take away here is that promotion seeks to raise awareness and acceptability of condoms. We really want to emphasize that duality as we move forward. Strong promotion efforts do include community feedback, assessment, and ongoing evaluation to ensure that measuring is relevant, it reflects cultural humility, and is reaching target populations.